My name is Wendy Costello and I help set up ICAN, which is the Irish Children's Arthritis Network.
My name is Kate Curtin and I'm a stage 4 melanoma patient, and I was one of the founding members of a group called Melanoma Support Ireland.
I really didn't know a lot about setting up a charity, and even at the beginning it was just a support group. So when we decided to go through the red tape of setting up a charity, I wanted to learn a little bit more, because at that stage I was just really involved in Crumlin Children's Hospital and meeting clinicians. But as Niamh got older, I realised there was a lot more going on behind the scenes in research. So this was something I decided I wanted to spend a little time on, and it just came up at the right time. The IPPOSI course was advertised and I really didn't think I would get it, because I really didn't have a lot on my CV at that stage, so I didn't think I was the person they were looking for. So I was absolutely thrilled to be accepted, and I just got stuck into it straight away.
I had a little bit of knowledge before I decided to undertake the course, but I really felt like it would strengthen my knowledge and it would put me as well in a better position to be able to explain to other patients, but also to be able to engage with the other stakeholders. They would know that I was coming from a level of understanding.
The big thing for me was learning more about research and clinical trials and how drugs are brought to market. This was something I knew absolutely nothing about. And it was quite tough going, and there was a lot of different sort of graduates on my course from different skill sets. But as a layperson, I really felt that I fitted in straight away. My fellow graduates really helped me along in some of the modules I struggled in, but I think it was definitely clinical trials that really caught my attention, and there was something I didn't think would, because I thought it would just be too hard for me. But I absolutely enjoyed it.
The clinical trials one was interesting. We got to find out, how patients are randomised and why they're randomised, and we got to learn about the different tests that are done within clinical trials. It was interesting as a patient who has been on a clinical trial before to see the background work that goes into it.
I think the fact that I knew nothing about researchers and how they worked, where they worked even, like I didn't know the work that's going on in UCD, because obviously it's rheumatology I'm interested in, and there was a Centre for Arthritis Research there which I knew nothing about. So it was literally being able to link in with them after the course and say to them, I've done this course, I'm not just a mum who's here knocking on your door wanting to help with bits and pieces. I've done this course, I know a lot about it, and they welcome me in, and I'm now on the steering committee for Centre for Arthritis Research.
One of the main problems that usually arises for us is access to new drugs. So the HTA module was very useful to me, and it's something that I've engaged in since finishing the course. I've actually done some submissions to the NCPE for the reimbursement of new drugs, which was an interesting process. As part of that, I've actually done surveys as part of the submission. I've done those on a European-wide scale through the networks that I've made with other melanoma groups in Europe.
PPI for me has been involved from the very start, before the funding application even goes in. I know you get labelled as the PPI person, but now I feel it's more of a level playing field, especially if you've done the IPPOSI course. Recently on a research project, they were doing a teleconference, but I actually made the effort to go to the first one and ask them to fund it, because I felt it was really important that they met me personally and I met them personally, and then we could move on and I could do teleconferencing after that. So that's why I think it's really important you're involved from the very start. You know exactly who's on the team and who's working, and your voice is valid.